Hi, everyone. Welcome. I'm Christine Buckley, the host of the Brain Aneurysm Foundation's 1 in 50 podcast, here to raise awareness and provide education on a disease impacting at minimum 1 in 50 people. So thank you for joining us. Welcome, everyone, to the 1 in 50 podcast. Again, we are really fortunate today to have somebody really special with us, Dr. Zayed Almadidy, better known as Dr. Z. He's in the Chicago area, a very talented neurosurgeon, but unlike many other neurosurgeons, he has quite a presence on social media, and he really helps bring neurosurgery to a very understandable level for anybody that may be having, various forms of neurosurgical treatment. So again, very much happy to have you and welcome, Dr. Z.
Thank you so much. Honored, privileged. I'm really excited to be here. Thank you.
Awesome. So for people who are just getting to know you, tell us a little bit about yourself, what led you to neurosurgery and what that path has been like for you to this point in time.
Yeah. It actually it's an interesting journey that I had because I started my medical school career thinking I wanted to do cardiothoracic surgery. So I always knew I wanted to do some sort of surgery. I just didn't know what. And then, in my 6th grade yearbook, it actually says, there's a section where it says future so-and-so, and you would put your profession of what you want it to be. And in my 6th grade yearbook, I put future heart surgeon. And, that's ever since I was a kid, I thought that's what I was going to do, which was wild. And then when I got into medical school, sure enough, I did my rotation on cardiothoracic surgery, which was great. And I loved it. But then I did an elective in neurosurgery, and I was blown away. I was able to see, the first case I ever saw was a NeuroPace implantation, which is a device that, you have to put into patients to monitor for seizure activity. Sometimes they can abort seizures before they can happen. And that was a device that I got to see. And I remember just seeing a chip being implanted into someone's skull with wires going to their head. I remember thinking that was the coolest thing I've ever seen in my life. And as fate would have it, my dad actually needed to have spine surgery. And he was affected by a horrible disc herniation that prevented him from walking. Sure enough, he went to the operating room with a neurosurgeon who did a microdisc for him. And after 45 minutes, my dad was able to walk out of the hospital after months of not being able to stand on his own feet. That really was the tipping point. When I said a 45-minute procedure, outpatient, and you can go home the same day and you can restore your mobility. That was one of the most eye-opening moments in my medical school career. And so I was privileged enough to be at a facility that had such a robust neurosurgical program. And so once I was able to kind of see that, I was, really excited to kind of make this the future career that I've always dreamed of. So I decided to pursue neurosurgery, and I did my training at the University of Illinois in downtown Chicago, where I trained with folks like Dr. Fadi Charbel, Dr. Sepide Aminajani. I trained with Dr. Sergey Nekrish, Konstantin Slavin. These are all the big names at UIC that I was privileged enough to kind of train under. And then after that, I did a year over at UCLA where I learned some more complex minimally invasive spinal surgery. And now I am in Chicago where I practice as a full-time attending.
Wow, that's amazing. It's certainly, that how many years is all that training?
Goodness. I counted 16 so far. So 4 years of college, 4 years of medical school, 7 years of residency, 1 year of minimally invasive spine surgery. All that stuff combined comes to around 16 years. And so I don't know a life where I haven't had my nose buried into a book. That's really been the majority of my entire kind of upbringing, is just me trying to study so I can get to this point.
Wow, it's amazing. But it's, to hear that number of years, people, I think, know the journey's a little long and arduous, but when you put it all together, that's quite something.
Yeah.
What has been like the most difficult thing, or what have been obstacles in your past to get to this point now, to get through residency and doing a fellowship and all that sort of thing, to be now a practicing neurosurgeon?
Yeah. I've been privileged enough to be able to have such a loving and supportive family. My dad, my mother are still around, and I got a lot of support from them during this time. And It goes without saying that neurosurgery residency is one of the most rigorous forms of training that a physician can go through. It is incredibly difficult, incredibly demanding, incredibly challenging. And so some of the obstacles that I would say I would have faced is the same as many obstacles that every resident probably has went through, which is when you're starting your residency training, you are taken from a point where you are a fresh medical student that just finished, and overnight you are suddenly in charge of 16 to 24 critically ill neurosurgical patients. You are the doctor for them. And so that transition was such a shock. It was a paradigm shift that made me realize, okay, you're in the big leagues. You have to step up and you have to take care of these patients. They are yours. And of course, you have supervisors, you have attendings that you can go to, but the nurses aren't calling your attending. The nurses are calling you. You are the one that has to figure all that stuff out. So that transition, I would say, was quite a big obstacle for me to kind of get over. And that's true of any resident, right?
Right.
And so I had to kind of put up with that, and I had to force myself. It's like being put into a crucible. That's how I like to see it. You're put into a crucible. You are transformed from a medical student into an attending physician through those 7 years. You are under an insane amount of pressure. You are forced to adapt, and you are put in an environment where you are constantly under stress, so that when you go in on your own into practice, suddenly it doesn't seem that bad, because that stress isn't always going to be the same, because as a resident, you are working 7 days a week, 80 plus hours a week, all the time.
Crazy.
Thankfully, as an attending, those hours are a little bit more forgiving. So when you go into such an intense training environment, by the time you leave, you start to think to yourself, you're like, you know what, I think I can do this. And then you realize that you have been training this whole time for this moment. So that was, I would say, the biggest obstacle, was kind of that big transition in the beginning.
That makes sense for sure. Again, people have different thoughts and opinions, and doctors and surgeons, and, everyone's looking for that bedside manner and all that kind of thing. So what I want to ask you, again, all the training that you had, all that stress, and now, you are a surgeon treating majority of spine. But what is the human side of being a surgeon in terms of dealing with the patients and family? What is it like, giving somebody that bad news? Like, say someone that has a rupture, just found out they have an aneurysm, and their loved one is, being prepped for surgery emergently, and they don't know what's going on. What is it like for you because that's a lot to handle, right? People want your expertise. They want you to make their loved one better. Yeah. But then there are those conversations and those difficult times. So what is that like for you?
Yeah. Obviously it's gut wrenching, right? So, I've been in scenarios where I was in my training at UIC, which was a very vascular heavy program. I got to see very, very sad cases of patients that would come in a persistent comatose state or severely obtunded, and they would have a subarachnoid hemorrhage from a ruptured saccular aneurysm. And so they would come in, we'd get a CT scan, they'd have a high-grade subarachnoid hemorrhage. You don't know if they're going to have a positive prognosis or not. And the family is baffled. They just don't know what happened, because it truly is a split second where this takes place. And I remember one event that stood out to me was a daughter of a patient who was a teenager. The daughter was a teenager. The mother was in her late years. The daughter said to me, I don't understand what happened. We were having breakfast 2 hours ago, and now you're telling me that she might not wake up. And that is such a crazy reality to have to comprehend as the family, but as the doctor, to have to deliver that news, you feel that impact as well. You can see the pain that the patient and the family is going through, and that takes such a massive toll on you. So being at UIC, I've seen hundreds, if not over 1,000 cases during my training of ruptured aneurysms that may or may not have been preventable with things like screening or with identifying important risk factors, smoking, hypertension, that kind of stuff. Things that people can do to modify their risk of having a ruptured aneurysm. People just don't realize that there's things that can be done to minimize this. People don't even know that intracerebral aneurysms even exist.
Right.
which was one of the biggest factors that kind of pushed me into kind of wanting to do social media. I've done a lot of videos on aneurysms. Yes, I'm a spine surgeon, but I've seen over 1,000 of these ruptured aneurysms that I felt like, I wish I could do something more. And having to tell that news to the family, like I said, is what kind of pushed me into where I am today. It was so difficult, so hard to share that information with them, to tell them that your mother might be gone. Because, in reality, the mortality rate of something like this is 40 to 50% from a ruptured aneurysm. That is a staggeringly high number. And half of those patients end up dying, right? So then I have to tell the family, hey, this is not looking too good. And it hurts. It really does. And so I wanted to do something to just spread the news that this exists. These are the risk factors. Here's what you can do, and here's who you can talk to. So I hope that kind of answers the question.
Yeah, no, definitely. And just one other thing I was going to ask, because it's a big part of the work of the foundation, is dealing with patients and families on the recovery journey. And I have seen a shift in the time that I have been here and dealing with different physicians who have support groups for this disease and have it at the hospital where the patients are treated and things like that. Do you think there is enough being done on the recovery side, like to provide support for patients and families? Or do you feel it is, important for a foundation like this to be that resource?
Yeah. Oh, no, I think there can definitely be more that can be done in terms of like emotional support and that kind of stuff. Is that what you're referring to?
Exactly.
Yeah, no, there's definitely not the most that we would do during my training. The most that we could do is offer some sort of counseling with a chaplain. That's really the most that we were able to do. But in terms of having a foundation, kind of a unified facility where patients can come to for resources and for some comfort, for some answers, that is monumental and absolutely critical and essential. The patients are affected as much as the family is. And so I think that is such an important factor to have to consider with the treatment of an aneurysm, not just the patient, but those that are taking care of the patient.
Yeah, no, good. Absolutely. Yeah. Another thing, how does, you're doing, again, it is amazing for people to think, and, through the years, sometimes I stop and think, to be in someone's body, to be, and seeing the spine and all the vessels and everything going on, or looking at the brain, and you're there in this intense situation. And, I'm sure it's like, hopefully 99% of the time things are going the way you want and you're making people better. But so how does your practice and the routine and the process that you go through every day, and your discipline and what you have studied and learned, impact your personal day-to-day life? I mean, it's got to be hard to have these days where you're treating in intense cases and then go home and forget about it. So how do you deal with that, or how does it factor in your day to day?
The reality is it never leaves your day to day. It really doesn't. I can have a case that goes 100% successful with no issues. Patient wakes up great. I'll still go home and I'll still scrutinize every single image, and I'll still try to figure out ways that I could have done better. I'll still figure out ways that I could have improved the flow during surgery. Anything that I could make better. I always just obsess over that. And I think that goes back to part of being a disciplined individual. I'm never satisfied with good enough. I'm always trying to push the envelope. I'm always trying to be better. I feel like a person should always work with a mentality that if you're going to do something, be the best at that thing. Yeah. Even if you're never going to be the best at that thing, still work with that mentality that you're going to, you know what, I'm going to be the number one in the world at this thing. And so in my mind, that is what I'm training to do. I'm training to be the best version of a neurosurgeon that I can be, but more so, I'm going to try to be the best in the world. And guess what? There's that saying where it's aim for the moon, and if you fail, you land among the stars. Yeah. Do that. Aim for something that seems like it's out of your reach. And then even if you're not successful at it, you've achieved greatness anyway. And so the reality is that part of my work never leaves me. Even when I go home, I still think about it. I still obsess. Now, if things don't go according to plan, unfortunately, during surgery, that's even another story. That's, I lose sleep over that sometimes. Right. So those are situations that are incredibly difficult. And thankfully, I've been in a situation where I've been trained by some fantastic neurosurgeons who have taught me how to always salvage the most extreme scenarios intraoperatively if things don't go as planned. So thankfully, I feel very well prepared for these situations and these events. So things are always under control, no matter what. You know, that is something that I learned from Fadi Charbel, who, no matter what happens, if there's an intra-op rupture, for example, of an aneurysm, half the time people don't even know that it has happened because it is under control immediately. Yeah. The vitals don't change. There's no shaking in his voice. He doesn't panic. It's just always extreme confidence and control and laser focus. And I picked up that trait from him. And so that's what I learned of how to manage these critical cases. And then what I've also learned from him is that once you're done, you go back after surgery, you fix the patient, you take care of the emergency situation, you go back after surgery, and you review every single step of that surgery that you did and try to figure out what happened and how you can improve. He recorded every single step of his surgeries every time under the microscope. So it was kind of like having a replay for a professional athlete. You can go back, see what happened, learn from it, do better next time. But truthfully speaking, you know, I was in the presence of a master neurosurgeon who rarely ever had situations like that ever happen.
Right.
But if they did, then I was able to witness how to manage those. So I hope that answers.
Yeah. No, thank you. You know, again, I like doing these podcasts with different people, and, you know, we have a focus of, you know, awareness of aneurysms and the risks and how to prevent it and research. But, you know, it's important to talk about all things. And I think it's important for now because, you know, being a neurosurgeon, the stress, the expectations, you know, the patients just want so much from you and expect perfection all the time. But I love what you said in your training, and, you know, you perform a surgery and you go back and look at the steps. So you're always learning, you know, even if it went well, could you done something differently? But for people to hear, you know, what it is like to have this stress in someone's life in your hand, and that you don't take it lightly, you know, that you have a passion and you're always learning and you're always wanting to put the patient first and provide those best outcomes possible. So I think that is just something that is really great for people to hear and, you know, truly understand, because what you're doing is not easy. So thanks for sharing that.
No, I appreciate you asking. And, you know, a message to the residents, anybody who's watching this, I want to really emphasize the absolute essential nature of scrubbing into every single surgery during residency, because when I was a resident, my biggest fear was that I would graduate being unprepared. That was my biggest fear. So when I was in residency, I was in every single case, no matter what, as much as I can. And I would do my absolute best to be there from start to finish for every single case. Even if it wasn't something that is, you know, within my focus or within my scope. Some, you know, for example, if plastics was doing a case that may or may not be closely related to neurosurgery, I would want to go learn how to do a perfect closure. I would want to do all that stuff. I wanted to be able to have the skill set and the tools to be able to independently manage whatever walks through the door. So now when I'm a general neurosurgeon, I'm hired as a general neurosurgeon with a focus on spine, but I'm hired as a general neurosurgeon. So I have to be able to do anything under the scope of neurosurgery. And so that was one thing that I would say I am so glad that I did as a resident, where I saw thousands of cases, and I scrubbed into thousands of cases as a neurosurgery resident. And I took those learning lessons, and now I have those in my toolbox, and I can say, hey, this is an interesting case, but I remember I saw something similar to this. And then I know how to apply those tools. I can call people and I can say, hey, remember we did that case? In fact, I did that not too long ago. I called one of our plastic surgeons. I said, hey, you know, I got this case. What do you think? And he walked me through a muscle flap, for example, and all that stuff. And it was, it's just such an important thing to do as a resident. Residency really is what you make it. And if you go in with your eyes closed and you're kind of complacent and you're just going through the motions and you're trying to get through, the reality is you're going to be a mediocre neurosurgeon, and nobody wants a mediocre neurosurgeon. You need to excel at what you do, so devote yourself.
Yeah. All right. Thank you. We touched upon a little bit earlier why you did get into social media, but can you say when you first started it, and was there like one thing that really pushed you into it? And I just want to say, you know, I think it's genius, and it just the way it prevents you speak very well and you present very well, and it's simplistic and your visuals are great. So for me, I think it's just amazing to have people have that information that to me doesn't seem to be anywhere else. So I'm looking at it, it's like you're filling a void. So how long have you been doing it? What was there one thing that really pushed you into it?
Yeah, thank you for saying that. I'm incredibly flattered by that. Thank you. I really do put in a lot of effort into those videos, so it's very nice to hear that kind of feedback. How long have I been doing it? Well, I've been doing it since I was halfway through my 7th year of residency. So that was in 2024. Early 2024 is when I would say I started. Late 2023, early 2024. So it's been, I'd say probably about 2 years at this point that I've been doing this. And I've been thankful enough to kind of have accrued kind of a following of over 1 million people across social media. And so it just blows my mind, honestly. It blows my mind that there's over 1 million people that are willing to sit down and listen to someone like me talk about neuroanatomy for the next 2 or 3 minutes. It's fascinating that people are interested, but that just goes to show you that people want to learn. They want to know these things. It's just a matter of putting it in a way that individuals who didn't go to medical school can understand. And so I've seen this in training where it's, sometimes a physician will walk into a patient room and they'll just start throwing medical jargon at the patient. And the patient is just kind of staring at them and they don't want to feel silly. So they just kind of nod along and agree. But, nobody that went to, if you didn't go to medical school, you might not know what hypertension is. If you didn't go to medical school, you don't know what tachycardia is, bradycardia, these things. It's not that obvious. So I always centered my videos to be in a way that anybody who is from the age of 10 years old to 90 years old can sit down and be like, oh, I get it, because I have a visual that goes with common speak. And that is important. I think that combination of two, to break it down in a simple way, people that are going to have surgery are going to be like, oh, that's what he was saying. Yeah. That's why it was important to me.
Yeah, no, I think it's amazing. So lastly, I do want to talk a little bit more about brain aneurysms, but what I want to ask you is why you think there's still so little known about them, like the overall awareness is so low. And I want you to speak to what you think is, most important for people to take away in terms of risk factors, signs and symptoms. But again, back to your social media presence. And again, what's expected from our community. We spoke a little bit. I know you communicated with Grace and our team after Kim Kardashian came out and said that she had a brain aneurysm, right? It was just, we had so many people reaching out, like what is going on and what is it? And I think, she just said it's stress and from her marriage, and kind of turned it into something that it really wasn't. So again, it was amazing to have Grace connect with you and you to just address it, not like spot on or, directly relating it to Kim Kardashian, but at that time to really address, what is a brain aneurysm rupture and what can make that happen. And I think it was really important for us to be able to share that, particularly because you're the specialist, you're the neurosurgeon, and to break it down again so succinctly and clearly for people to understand. So, for us, it was great to have you as that resource. So again, I want to thank you for that, because it helped quiet down the people who are, saying, why is she saying this or that? And we're like, oh, we don't really know, but let's tell you what it's all about. So if you can just, quickly highlight what you feel is most important to know about brain aneurysms, what for people should look out to and when they should react to signs and symptoms, that would be great.
Absolutely, 100%. So right now what the research tells us is that the two biggest modifiable risk factors that anybody can kind of adjust during their lifestyle. Number one, uncontrolled hypertension. Anybody who has uncontrolled hypertension is already at a higher risk of developing an intracranial aneurysm. And then the other thing is smoking. Smoking cigarettes. People don't really realize that smoking really is an incredibly dangerous thing, not just for the obvious things like lungs and your heart and that kind of stuff. The brain, the vasculature, the cardiovascular system is impacted by it. So is the brain. The neurovascular structure is affected by it. These are two things that I think are absolutely essential. Get your blood pressure checked. And if you're a smoker, you got to stop immediately. Now, those are two things. Now, there was a study that was recently done, I think it was in 2021, that is now trying to make that one of the screening guidelines. The official screening guidelines say that if you have one or two immediate family members with subarachnoid hemorrhage in the past, if you've had a previous subarachnoid hemorrhage, or if you have any sort of genetic disorder that predisposes you to a collagen disease like autosomal dominant polycystic kidney disease, Ehlers-Danlos type 4, these are the types of diseases that would trigger a screening. If somebody has never had any symptoms or anything, then you could get something like an MRA, for example. But more importantly, there was another study that was done that looked at patients that were over the age of 35 who had uncontrolled hypertension and were long-term cigarette smokers. That school of thought also says that these individuals have a 7% prevalence of developing an aneurysm, which is even higher, obviously, as you know, than the general population, which is the name of this podcast, right? The 1 in 50, the 2%. So it's even higher than that. It's a huge number. And so these individuals, I think, are the ones that need to be helped the most: uncontrolled hypertension and smokers. And then the individuals that have the non-modifiable risk factors, the ones that we talked about, the family history, the personal history, and the genetics, those are individuals that need to be closely monitored. The final thing I want to mention is that, yes, for screening, we do recommend an MRA and a CTA, that kind of stuff. But it's important to recognize that anything less than 3 millimeters is not going to be picked up by those scans. And it's important to consider the possibility, if you're a neurosurgeon or whatever, a doctor, it's important to consider the possibility of a diagnostic cerebral angiogram so that you can find those small aneurysms, because then you can follow those closely over time and see if you need to intervene sooner than later. And I would say that's the most important thing to kind of mention.
Yeah, no, that's great. I mean, for us, what we always stress for people is obviously why we want people to know the signs and symptoms and to be aware and to know the term brain aneurysm is because they are so treatable, and the treatments keep getting better and better. And it's a shame when we hear the number of stories we do where either someone has been misdiagnosed or not sent for a scan and then subsequently ruptures. So if our goal is to have a world without ruptures. At this point, it doesn't seem like we can stop an aneurysm per se from forming. I don't think we're there yet, but if it's there, let's find it and let's treat it and get people back to their families, communities, and workplaces. So that's, what's most important for us. But again, I just want to say thank you to you for giving us this time, but also what are the I know you're on Instagram, TikTok. What are the platforms people should go to find you and follow you?
I'm on YouTube, TikTok, Instagram. I'm on LinkedIn.
Okay, good.
Twitter, and any sort of social media platform, any sort of area that somebody wants to connect, I'm happy to do so. I do not offer medical advice, so I'm very strict about that, but I'm always happy to talk with anybody. If they have just general questions, I'm very responsive to messages.
Okay, so, that's great.
Thank you. And as you said earlier, I go by Dr. Z Neurosurgery, and so that's how they can find me.
Yeah, no, that's great. We're working with a group of medical students, and they're all following you too. Some in Kansas, some in California. So it is amazing your reach. So I do want to say thank you for raising awareness and education across the neurosurgical board, particularly for brain aneurysms for us, and helping address, the situations that sometimes arise here. And we're certainly going to keep following you and sharing you, and hope that you do the same with us.
Thank you so much. I'm happy to do so.
All right. Thank you, Dr. Z. You have a good rest of your day.
I appreciate that. You too.